Good morning, everyone. My name is Ken Harkin. I'm a HOTUS professor and head of medicine at Kansas State University. And today I'm going to present to you the results of a study that we performed here in an evaluation of Fortetropin in geriatric and senior dogs with reduced mobility. And this was just recently published in the Canadian Veterinary Journal and should be available for everybody in the next 3 months. So as much as we don't like to admit it and often refuse to accept it, our dogs age too fast. And that aging is far more rapid in our pets compared to that of humans. And it really presents a health challenge for our patients that our pets that we're oftentimes maybe not ready to accept because they've only been with us for 10 years or so. And even in the absence of many age-related diseases such as chronic kidney disease, cancer, severe degenerative neurologic disease, and our patients, our pets, develop mobility issues. And those mobility issues are associated with osteoarthritis, which can result in kind of chronic pain, and then age-related muscle atrophy or sarcopenia. And all of those things really limit our ability to enjoy our pet because they become less active, oftentimes less interested in walks and playtime, and that really affects the human-animal bond. A couple studies here that were published to kind of look at some of the issues associated with age. And the first one here, published in 2012, was geriatric screening in first opinion practice. And this is a relatively small study. It looks only at 45 dogs. But in these geriatric dogs, they looked both at what the complaints were or the recognition of problems were by the owners. And one of those, the highest one, was increased sleeping, and 31%. And if you're more tired, you're more weak, you're going to sleep more often. The other is lameness and stiffness. They reported in 22% of the dogs and slowing down in 20% of the dogs. And then on physical examination, what was recognized by the veterinarians was a reduced range of motion in joints in 24%. So a full 24% of these patients have osteoarthritis. Pain was obvious in 15%, stiffness and crepitus in 13% both, and then muscle wasting in 11%. And this study doesn't really break these down to know how many had muscle wasting in the absence of reduced range of motion. But it's certainly possible that there would be patients and pets with sarcopenia or age-related muscle loss that don't have osteoarthritis yet. So their activity is affected just by that sarcopenia. And this next study, published in 2018, looked at the prevalence, duration, and risk factors for osteoarthritis in a really large population of dogs. And the total number of dogs looked at here was over 450,000 dogs. And then they looked at all these patients and their final determination and important things was that osteoarthritis affects 11.4% of a pet's lifespan. And that's a significant part. Of course, that's going to be towards the end of a pet's lifespan. But the risk of osteoarthritis in dogs that was between 9 and 11.9 years of age was 36 times the risk for dogs that were less than 3 years of age. And for dogs that were more than 12 years of age, that was 58 times risk of osteoarthritis. And in dogs in that 30 to 40 kilogram weight category, they were 8 times higher a risk of having osteoarthritis than dogs that weighed less than 10 kilos. And dogs that were more than 40 kilos had a 11.2 odds ratio. So even higher risk of osteoarthritis than dogs weighing less than 10 kilos. So I think you can recognize, especially in our larger breed dogs, how osteoarthritis can have a significant impact on their life and their mobility and how we enjoy our pets. And we talk about sarcopenia. This was a study published in 2012 also that looked at Labrador retrievers, and they picked a specific group of dogs, a specific breed rather, so they could compare that breed to different ages. And they picked Labrador retrievers between 1 and 5 years of age for one group, and then over 8 years of age for the other group. And all dogs had to have a body condition score between 5 to 6 out of 9, and 5 being ideal body condition score. So all these dogs were really in good shape and good body condition score. They excluded any dog that had osteoarthritis. So they wanted to eliminate that as a potential cause for loss of lean body mass or muscle, just from disuse atrophy. And then they looked at the mean epaxial muscle area, and they did this both by CT and ultrasound. And they found that the mean epaxial muscle area was significantly lower in healthy old dogs. And through the study and in their discussion, they say that physical activity alone may not be sufficient and the most effective means of managing sarcopenia in these dogs. And they talked about anti-catabolic agents, even mentioned non-steroidal anti-inflammatories as a potential means of improving lean body mass. And then also talked about adequate substrates, which is a nutritional issue. And so enough protein. The question is even that sufficient? And are there other options to improve lean body mass in older dogs? This next study was an interesting one, and these were laboratory Labradors. And this study published in 2016, and they followed these dogs for 10 years. So this is a very long-term study. And they classify dogs in terms of having normal lifespan, long lifespan, or exceptionally long lifespan. And exceptionally long were dogs that lived, Labradors that lived more than 15.6 years. And I think if you know Labradors, that's a long lifespan for a Labrador. Excuse me. After the age of 9, dogs with exceptionally long lifespans continued to gain weight from the 9 to 13 year range, while all the other dogs, even the dogs in the long lifespan, lost weight. And the one thing that they noticed also in the study was that the maintenance of lean muscle mass or lean body mass or muscle was slower in exceptional and long lifespan groups than it was in the normal lifespan group. So the question that this study raises is, if we maintain lean muscle mass and muscle, does that help us live longer, or is it just a function of those dogs that maintain muscle mass are just the ones that are going to live longer as a predictor? But if the former is true, then once again, can we do something to help these dogs maintain muscle mass and potentially live longer, healthier lives? And so I put in this diagram kind of what I view as kind of an interconnection between sarcopenia, osteoarthritis, cachexia, and disuse atrophy. And sarcopenia, I put this description down here in the definition, a syndrome characterized by progressive and generalized loss of skeletal muscle mass and strength with a risk of adverse clinical outcomes such as physical disability, poor quality of life, and death. And this is from human medicine. But I think the same applies for our pets, for dogs, that sarcopenia, even in the absence of any other disease, any other chronic disease in our pets, can certainly result in adverse clinical outcomes. And it may affect also immunity and may be a predictor, once again, of early death in those pets. And osteoarthritis, of course, as we mentioned, is particularly common. It's a progressively painful degenerative joint disease. And there are a lot of different factors that play a role in degenerative joint disease. And one of those is obesity early on in life. And obesity, because fat tends to, the adipokines in fat may have an adverse effect on the joints, and even just the weight related stress. So even if they lose weight later on and become leaner dogs, that inflammation oftentimes is there. But even in the absence of obesity early in life, many dogs are, of course, going to develop osteoarthritis. And we see this in, an age-related change. And more than 90% of dogs that are past the age of 5 can be found to have some degree of osteoarthritis. Large breed dogs, as we mentioned, have a higher risk for osteoarthritis in certain breeds. In one study, golden retrievers and Labrador retrievers were a higher risk odds ratio compared to other dogs for osteoarthritis. German Shepherds were also on that list. Rottweiler was on that list. So there are others. Old English Sheepdog, but that was a UK study, so that may skew the Old English Sheepdog there. We don't see too many of those, at least in our practice. And males may be also at a higher risk factor for osteoarthritis too. In diagnosis of osteoarthritis, oftentimes it's a physical diagnosis, physical examination diagnosis. The veterinarian sees the patient, they recognize the lameness, they identify the decreased range of motion, the crepitus in the joints, and so they make this presumptive diagnosis, which is usually right, of osteoarthritis, and usually begin the patient on a non-steroidal or some other joint supplements. But we also can do radiographs to confirm and make sure that this is not a erosive polyarthritis or some other cause of joint disease or severe lameness in our patients. So radiographs may supplement our physical examination to help confirm the diagnosis of osteoarthritis. But when they have osteoarthritis, that's going to make patients less likely and less willing to move around. And when the joints are less supported by sarcopenia, muscle mass is lost, then that further reduces their willingness to exercise. And we certainly know that building muscle helps reduce the pain of osteoarthritis. And so if they're losing muscle mass because of sarcopenia, that's going to make their osteoarthritis and the clinical symptoms of their arthritis even worse. But then osteoarthritis, because they're less willing to move around because of pain, can result in disuse atrophy. And disuse atrophy and sarcopenia have a fairly similar pathway of muscle loss, and it is tied into expression of myostatin. Myostatin is a hormone that causes muscle atrophy and prevents muscle growth. And so inhibiting myostatin could be important in minimizing this muscle loss and reducing the clinical signs of osteoarthritis in our patients. And once again, in cachexia also works through this same pathway. And all the old age-related diseases in our patients can worsen sarcopenia. So if they have chronic kidney disease on top of their age, they have cachexia and sarcopenia that worsen their muscle mass and a loss of muscle mass even greater in those patients. So the problems that we were proposed or that we presented with is this loss of lean body mass and osteoarthritis contribute to decreased mobility in geriatric dogs. And not all pet owners have access to physical rehabilitation centers with experienced personnel. And because we certainly know that underwater treadmill and swimming and certain exercises with an experienced physical therapist can help our patients maintain or restore some of their muscle mass and mobility. But not everybody has that opportunity and the availability of a physical rehabilitation center. So what else can we do to help these pets live better lives with improved mobility? Things that we knew is that Fortetropin prevented the rise in myostatin and minimized the loss of lean body mass in dogs following TPLO surgery. So a common knee surgery in dogs for anterior cruciate ligament rupture. And that study was done here at Kansas State University. And most of those were young to middle-aged dogs with ruptured cruciate ligaments. But the question was, if we use the same product, could we help minimize lean body mass loss or even rebuild some muscle mass in our geriatric population? And then this study was published in 2020, looked at the use of Fortetropin in geriatric men and women. And it found also that Fortetropin administration resulted in an 18% increase in fractional synthetic rate of muscle protein. And this is a relatively short study, but still, in that relatively short period of time, it had a substantial increase in muscle protein synthesis. So our questions would Fortetropin benefit the geriatric dogs with reduced mobility? And the other question is, do we have an objective way to measure the effect on mobility? And I'll start by telling you that we wanted to use activity monitors in dogs, and we did start with some activity monitors that we in our study, but they did not work. So they were oftentimes gave completely erroneous results. But fortunately for our study, we didn't rely just on the activity monitors. We also went with a questionnaire and a questionnaire that had been validated. And that was the LOAD, or the Liverpool Osteoarthritis Activity Index in Dogs, and the LOAD questionnaire. And this was a client-based clinical metrology instrument that has been validated for use in dogs with osteoarthritis, and really uses kind of owner-friendly language to create a numerical score associated with mobility. And although we didn't verify osteoarthritis in our dogs, our patients all had decreased mobility and clinical signs that would be consistent with osteoarthritis. And so that we felt that this load questionnaire would be simple and usable for our patients. And just so you can read those questions, this is the left-hand side, and you can see many of these questions here. How's your dog's mobility in general? How disabled is your dog by their lameness? How active is your dog? At exercise, how active is your dog? And these are really basic questions to generate the score. And this load questionnaire has been shown to correlate very nicely with force plate analysis in dogs. And this is the right-hand column there. So some other questions, and really basic 13 questions. And ultimately we create a load score. And this load score can be as low as 0, which means a completely normal, healthy dog, or as high as 52, which would be a dog with severe mobility issues. So this was a randomized, double-blind, placebo-controlled study. So myself and Dr. Katie Hetrick involved in the study, we didn't know what the patients were receiving. The randomization was done by the third party. And so we would just follow the schedule on who received which product A or product B. And clients, once again, clients didn't know what they were receiving either. The dogs could not have any disease that could affect 6-month survival. So any patient with chronic kidney disease, liver disease, cancer, we excluded all those patients. So we really wanted patients that we know would still be around for at least 6 months, even though the study wasn't lasting 6 months. Dogs had to have at least 3 of these: lameness, weakness, decreased mobility, decreased voluntary activity, subjective loss of muscle mass, or reduced exercise tolerance. So as long as they met 3 of those criteria, they were included in the study. And then we did load scoring. So I had owners fill out those questionnaires at week 0, week 6, and week 12. We had 23 dogs that ultimately ended up with on Fortetropin, and 23 dogs on the cheese powder or the placebo. And these are really similar in their composition. So just in case you think there's a big difference in the protein, fat, and carbohydrate content. So the Fortetropin is 33% protein. The cheese powder is 36% protein. The fat content of Fortetropin is 55%. It was 48% for the cheese powder. And then the carbohydrate content is 7% and 4% respectively. So these are really identical, really close. This is a really good placebo. This is the same placebo that was used in the geriatric human trial. And once again, as I mentioned, these are where the load scores can range from 0 to 52. And then our statistician, Jim Roush, was also blinded to the control and treatment groups, but we also blinded him to what the scoring interpretation meant. So we didn't tell him that a higher number was worse and a lower number was better. He didn't know what the scores meant. He was merely meant to compare the values. And then our statistical analysis that he did. So the comparison of the load mobility scores between the 2 groups from week 0, 6, and 12, and the change in scores between weeks 0 to 6, 0 to 12, and 6 to 12. Those are all compared with the non-parametric t-test and the Mann-Whitney U-test. And then within each group, the load mobility scores were compared for each time period, 0 versus 6, 0 versus 12, and 6 versus 12, with the Friedman's test for repeated measures over time. And we set significance at p less than 0.05, and all of our statistical analysis was done on commercial software. So this is kind of the distribution. This table shows the distribution of the dogs in the different groups, in the Fortetropin and the cheese powder group. And you can see they're very similar. And that was part of our randomization, to have a similar number of dogs in each weight, age, or weight range. So our large breed dogs, we had 11 in the Fortetropin and 15 in the cheese powder group. You can once again see that breakdown of our dogs. We had a few more dogs in the small, less than 9 kilo group for the Fortetropin, but these numbers are really similar. And you can see the age range, and the median age for dogs is pretty close for all groups also. And then you can see this breakdown in the clinical signs reported by the owners. Lameness, pretty similar, decreased mobility and or weakness. All these numbers are pretty similar across the board. And then once again, muscle mass loss recognized in 17 of 23 in both groups of dogs. And this is a very busy slide. I apologize for that, but this is our statistical analysis. And in the square is the big comparison here. And that is what you can see is the comparison of week 0 versus 6 and 0 versus 12 in the Fortetropin group and in the cheese powder group or the placebo group. And there was a statistically significant difference in load mobility scores between week 0 and 6 and week 0 and 12 in the treatment group, but not in the placebo group. And you can see the P is 0.03 and 0.006 in our Fortetropin group and 0.16 and 0.13 in the cheese powder group. The control group had a larger range and interquartile range in the load scores for all 3 time points compared with the treatment group. And even though you can see we don't have a statistically significant difference in the load scores across the board, this variance is this huge variance in our cheese powder group or the placebo group is really responsible for why they don't see a statistical difference in their week 0 versus 6. But our variance is much lower, and this statistical significance in the Fortetropin group really appears to be important and relevant and statistically different, obviously, in the Fortetropin group. But if we wanted, we did the numbers and did an additional power analysis. If we are looking for a statistical difference in the Fortetropin and cheese powder groups, if we increased this with the same results, if we increased to 50 dogs in each group, it looks like we would have a statistical difference at that point in time. That's how many dogs we'd need. So 100 dogs was kind of out of our range of doing the study. 46 was a pretty good number, at least we felt. And once again, we still see a statistically significant improvement in load scores in the Fortetropin group, which we do not see in the placebo group. Just kind of summing up, and there's a couple of quotes from different authors. And the first one, he says, sarcopenia, far from being a pathology of specialistic relevance, is a multidisciplinary and systemic health problem that involves orthopedics as well as geriatrics, internal medicine, and nutritionists. And, I believe that's true, is that, we just accept oftentimes sarcopenia as just a normal function of age, but I think we need to look at it as something that seriously impacts the expression of osteoarthritis and plays a role in the life and healthy life of our elderly dogs. So something that we really need to address and maybe need to address a little bit more significantly than we've looked at in the past. And this is a quote from Dr. Jaffe at Mississippi State, and he says, to minimize sarcopenia and thus improve patient mobility, treatment by reduction of serum myostatin levels with Fortetropin showed promise compared to a nutritionally similar control. Hetrick and others demonstrate a statistically significant improvement in owner-assessed load mobility scores after 6 and 12 weeks of treatment compared to a placebo supplement. Based on studies such as this, it is my opinion that use of a product that inhibits myostatin levels to reduce sarcopenia, such as Fortetropin, should be considered a valuable component of multimodal management for the treatment of canine osteoarthritis. And multimodal, I think, is an important component of that, and physical rehabilitation and underwater treadmill and exercise. But I think, as stated earlier, those alone and exercise alone may not be enough to restore lean body mass, and something that inhibits myostatin, that such as Fortetropin, is an important addition to this multimodal response to treat sarcopenia and manage canine osteoarthritis in our patients. So just to summarize, sarcopenia and osteoarthritis negatively impact the mobility and quality of life of dogs. And these are really interrelated concepts of sarcopenia and osteoarthritis. And I would even probably put disuse atrophy also along with sarcopenia. So sarcopenia and disuse atrophy really impact osteoarthritis and vice versa. Fortetropin supplementation showed mild but statistically significant improvements of the mobility scores for the treatment group at both week 6 and week 12 compared to the baseline score, but no statistical improvement was noted at any time in the placebo group or between the treatment and placebo group. And I think, once again, we felt that there was a significant improvement, and patients that were evaluated in hospital. I recognize that COVID did affect some of our evaluations. When they were evaluated by us and kind of a global assessment of how the patients were doing, those patients that were ultimately found to be receiving the Fortetropin, for the ones that came back, we found that 8 dogs had we felt an improved muscle mass, and 8 dogs had stable muscle mass, and we didn't feel any dogs had lost muscle mass in the treatment group or Fortetropin group, as opposed to the placebo group, where we only felt 1 dog had improved muscling and mobility, 4 dogs were stable, and 3 dogs had lost muscle mass. So even in our assessment and global assessment of these patients on examination, we felt that there was an improvement in the treatment group as compared to the placebo group. And then finally, in the summary, reducing sarcopenia through Fortetropin supplementation can be a valuable component of a multimodal strategy to treat reduced mobility in geriatric dogs. And especially in areas where you don't have ready access and weekly access to swimming and underwater treadmills and physical rehabilitation, Fortetropin supplementation is a valuable component and valuable addition to the diet of these dogs to help them maintain lean body mass or muscle through the rest of their life.